You're listening to the Jōrni Podcast. When chronic skin conditions take over your life, where do you even begin to heal? Today, we go skin deep to find out. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we shift our perspective on skin health, exploring the deeper connections between chronic skin conditions and the body's overall well-being. Our guest shares insights from her extensive experience in both dermatology and functional medicine, showing us how factors like stress, gut health, hormones, and daily habits influence our skin in profound ways. Kerry Jenkins is a certified physician assistant in Florida. She graduated from Nova Southeastern University in 2000 and received her master's in physician assistant studies from the University of Nebraska in 2007. Kerry has been practicing medical and aesthetic dermatology for the past 25 years. Her functional integrative medicine education includes certifications through the School of Applied Functional Medicine and the prestigious Institute of Functional Medicine. Kerry combines her expertise in conventional dermatology with the principles of functional medicine to treat skin conditions at their root cause, ensuring long-term health and results. She offers invaluable insights into how treating the whole body rather than just the skin leads to lasting improvements in skin health. Kerry believes every patient has a story, and through story sharing, we gather details to map out the history and implement a plan for true healing. She understands that all areas of their lives, physical, mental, and spiritual, are interconnected and a necessary part of their healing journey. When she's not working, she's a mom to 2 ambitious girls and enjoys ballroom dancing, hand lettering, and being outdoors in nature. Let's meet Kerry Jenkins. Hi, Kerry. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because we will be talking about functional dermatology. And I have to say, we now have, I think, just over 300 episodes on the podcast, and we've never done an episode on functional dermatology. And I always get so excited when we have something new to offer our listeners. So thank you for being here today. I can't wait to dive in, and welcome to the podcast.
Thank you so much. It is my absolute pleasure to be here and have this exciting conversation with you.
Yeah, I feel like so many listeners will be able to relate to this because dermatology is one of those tricky things in my experience that it can be very hard to find any kind of answer. So I'm glad you're here to tell us more about that. And for starters, Kerry, do you want to share maybe a little bit about your own story or your journey that brought you to what you're doing today? You said you also have an interesting piece with a family member to add, and maybe let our listeners know a little bit about yourself and what it is that you do today so they can get to know you.
Absolutely. So I am a physician assistant practicing in the US, and straight out of school, I went into the specialty of dermatology, which is pretty amazing. And I'm so grateful for the opportunity. I've worked in the same practice for 25 years. And I went to school with the heart of a healer, thinking that I'm going to go to school and I'm going to come out and I'm going to be able to really help people. And it took me many years. Life starts, right? I graduated from school. I took my boards. I started practicing. I got married. I had 2 children. I was running a house, working, all the things. So it was probably 14 or 15 years into me practicing. And my youngest child, who at the time was 13 years old, began having some digestive issues. There was nothing that was really wrong with her. She just came to me and said, Mom, I'm just not feeling good. My tummy just doesn't feel good. And, the first time she said it to me, I paid attention to her and asked her a few questions, and she really couldn't pinpoint what was wrong. So in all honesty, I pretty much brushed her off. And then I began paying attention to her when she was eating. And I noticed that she would belch after eating. And after she would eat, she'd complain of just feeling really full. And I recognized that as being bloating. And she just didn't have the words or vocabulary to let me know what was going on. So as I started tuning into her and really understanding, there is something going on here and I need to be proactive and do something about it, a realization came over me, and I realized that I didn't really know what to do because I couldn't identify what was really wrong. Like, it wasn't this crystal clear thing where I could identify the problem and implement something to help her. So it started me on this journey, and I was really having a relationship with Dr. Google at night at the end of the day, right? As everything is done and taken care of, now I have time for myself. I was on Dr. Google and I was Googling and trying to figure out what was really going on with my kid. And I had this epiphany, sincerely, and it was an epiphany where I knew that if I took her to her pediatrician, they would scope her from the top, scope her from the bottom. They would do some sort of radiology imaging study. They would label her with IBS. They would prescribe a medication, and that would be their workup. And I knew that in my heart, deep down in my soul, that was not going to fix what it was that we were dealing with. And I just want to be crystal clear here. I am not anti-conventional medicine. I'm not anti that. In acute case scenarios, our medicine is amazing. But when you're dealing with people that have chronic conditions, they tend to be swept under the rug and just not addressed appropriately. And as time went on, because I didn't know what to do, I didn't do anything. I kind of was in analysis paralysis. But at the same time, every night I was spending time on the internet and reading and looking things up and finding really cool people that had different things to say, different opinions and thought leaders and innovators. And after a while, I was very fortunate to stumble upon a functional nutritionist in my area. And I came to my 13-year-old daughter and said, hey, listen, I found this nutritionist. What are your thoughts on seeing a nutritionist? And she's like, you know what? Why not? Let's do it. And I thought, okay, if the kid is open to doing it, I'm going to make an appointment and going to go. And I will tell you that was the beginning of the change of my entire life and my career. We made an appointment with this nutritionist. She spent 2.5 hours with us. She rocked my world like nobody's business. She opened up an entire new way of thinking. And I was absolutely blown away. And I realized that this was what my true calling was. This is why I went to PA school. This is what I thought I was going to do when I graduated. And, like I said, life gets busy, you get stuck, you're working, and you don't realize that you're in this medical machine. And I really wasn't helping people truly heal. And this nutritionist opened my eyes to this brand new world. And I will never forget, at this point, I'm listening to podcasts, I'm reading books, I'm attending online summits, I'm doing all the things and submersing myself in this world. And I was having kind of like the angel and the devil sitting on my shoulder. Like, the angel's like, Kerry, if this feeds your soul and this is your passion, like, go ahead and leap into it and have faith that it will all work out. And then the devil on the other side is like, who do you think you are? You can't, people are going to laugh at you. They're not going to take you seriously. You don't really know what you're talking about. You'll never make it work. Don't take the risk. So it was this constant battle back and forth on, do I embrace this and really do it, or do I not? And I will never forget, there was one very defining moment. It was the end of clinic in a dermatology, a conventional medicine dermatology clinic day. My nurse presented a 16-year-old new patient. This girl was just diagnosed with systemic lupus erythematosus, and she was new to our practice. So I went in and introduced myself, and I sit on a rolly stool, and I put my hands on my patients. I always touch them, and I introduce myself. And I said, tell me a little bit about why you're here and what can I do for you? And I will never forget, this was like the thunder aha moment. This 16-year-old looked at me and said, I was just diagnosed with lupus. My aunt and my grandmother are with me. They have lupus. And I need you to help me understand how my diet affects my disease. And I'm telling you, it was like lightning bolts happened in that exam room. And I took a moment to compose myself because I was about to burst into tears. And in my mind, I had a moment with the universe and I said, okay, I received the sign loud and clear. It has been received. And I looked at that 16-year-old girl and I said, you know what? That's an amazing question. And I don't have the answer for you right now, but I promise you, we will figure it out together and you will not be alone on this journey. And that was the beginning of my aha moment where I said, I have to do this.
Wow. Thank you for sharing that story and also the story of your daughter. I feel like all of that kind of came together to bring you to where you are today. And I feel fortunate that we have individuals like yourself in our healthcare and care systems because, as you said, a lot of the things do get swept under the rug. We don't get taken serious when we have concerns that might require some investigation, some root cause investigation, a lot of time investment, which physicians unfortunately often don't have. They don't have the time and resources to really get into things like that. So I feel very fortunate that you actually went down that path. And of course, people who get to work with you also get to explore what actually is at the root of their challenges. And that is one of the questions that I feel we have a hard time answering for many of the things that go on with us. So when you mentioned that you focused a lot on nutrition, so of course, we also wanted to talk about functional dermatology. So how do those things connect together? And how did you end up kind of moving from the nutrition part to the dermatology part? I feel like there's a big connection between those two things, but what made you interested in the dermatology part and how did you end up in that specialty?
Well, when I had the aha moment at that, last clinic visit of the day in my dermatology practice, I drove home that day and I did not turn the radio on. I had complete silence in my car. I rolled the windows down. I tried to connect with the outside world as much as I could. And I just really let the emotion flow through me. And I made a commitment that I was going to pursue this in whatever form it ends up taking, right? I'm committed to this journey. I'm committed to this process. And, it was that day that I took a leap of faith. I jumped off the edge of a cliff and I decided I'm going to start my own practice. So in doing that, first, you have to educate yourself on all body systems. I say, as an integrative and functional medicine practitioner, that I am an amateur neurologist, pulmonologist, gastroenterologist, immunologist, right? You have to have a foundation of understanding of all of these systems because they're all intertwined. So when I first started this practice, I knew that eventually I wanted it to be dermatology. And when I first started practicing, I thought, well, I'm just going to treat skin stuff. So I don't really need to do a deep dive into neurology or pulmonology or gastroenterology or all of these things. And then very quickly it came to me like, nope, that's not how it works. You have to have the broad understanding before you can niche down. So I have spent the last 6 years investing heavily in my education to be able to treat people efficiently and very effectively in a whole body focus. So people that come to me with skin concerns, obviously we're focusing on their skin, but deep down, we have to realize that the dysfunction that is inside of them is coming from their belly, their gut, right? And what is the biggest influence on our gut? It's our nutrition. It's what we feed ourselves every single day. So that's kind of how the bridge connected the nutritional aspect into the dermatology practice.
Yeah, it's very interesting that you say that. I feel like the gut is becoming and maybe it has been for a while, but it's really becoming a topic of interest for many specialists, for many doctors, nurse practitioners, nurses, because of its connection to so many things in the body. Of course, our gut is also influenced, by our emotions, by our movements or activity or lack thereof, if we're very sedentary, our nutrition, as you said. So I feel like the gut is sort of this hub that really affects a lot of things in our body and even in our mind. So what kind of things do people come to you with? I mean, sometimes we have a rash or we might have acne, but are there any things that you get to hear about a lot? I feel like in this world where we have a lot of stress, where people are maybe not getting the best nutrition that they could be getting, a lot of us are very sedentary, we're not moving enough. I feel like there's probably a lot of things that you see quite often that maybe are a bit telltale of how our society is moving in terms of health and mental health. So what do you see when people come to ask you for your help with their skin issues?
I'm so grateful that you brought in the gut as being the primary central hub. Like, no pun intended, but it is at our core, right? That's what our core is. And it affects everything. You've heard about the gut brain axis, the gut skin axis. There's a gut everything axis. So essentially, when we're talking about dermatological conditions, I'm really focusing on those chronic conditions that people have, that when they go to see their primary care provider or a specialist like a dermatologist practitioner, they are immediately prescribed a topical cream or a topical preparation to put on the skin. Or if the topical preparation fails, the next step in management is often a biologic immunomodulating medication. There's no in between. We go from 5 to 95. There's like all this, middle space. And they go from a topical application to let's put you on a biologic drug that's going to immunosuppress you forever, because once you start that biologic drug, you're on it indefinitely. So it really allowed me to say, okay, I want to treat this differently. So the people that I see, again, are these chronic skin conditions like acne, rosacea, alopecia areata, lupus, hidradenitis suppurativa, rosacea, atopic dermatitis, or eczema. These are all relatively stable chronic conditions. So when these people come in with these diagnoses, the first thing that we do is we address the foundations of health. And what is that? It's what you just mentioned. It's your level of stress and how are you managing that stress on a daily basis. It's your nutrition. What are you using to fuel your body day over day? Are you eating whole, nutrient-dense foods, or are you eating fast foods, processed foods, junk foods? How are you sleeping? We all know that sleep is when our body does all the housekeeping and our immune system is really heavily working during that time. So what is the quantity and the quality of your sleep? Are you waking up feeling rested and ready to start your day? And then movement. How much are you moving? In today's society, there's so many of us that are sitting behind a desk for 8 to 12 hours a day, and we're not getting outdoor time. We're not getting movement the way our ancestors do. So the first thing that we address when I get a person that comes in with a chronic skin issue is we're looking at the foundations of health. Where in those 4 pillars do you need the most support? And quite honestly, most people need quite a bit of guidance on all 4, because our society is go, 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 do, more, faster, better. And it's just gotten to be completely out of hand.
Yeah, it's very fascinating that you mention that, because I feel like oftentimes the skin is treated as this annoying external thing that we can just patch up and slap a cream on it or take a pill. I was told to just take the birth control pill. That would fix it, without actually looking under the surface where most of this originates, where the root causes usually are laying. So very fascinating how you describe how that all comes together. I'm curious about one more thing, Kerry. And that is our hormones, because especially as women, I feel like we struggle a lot during various times in our lives with hormones and how they affect not just our internal workings, but then, of course, also our skin. So, how does that connect together with what you do in functional dermatology?
Absolutely. So, as we all know, for females, hormones are a dynamic process. Even when we test hormones, whether we test them with saliva, with blood, with urine, however we're trying to test hormones, the result of that testing that we get is an instantaneous snapshot in time. That day, at that time, at that moment, that's where that hormone level was. 30 seconds after that saliva sample or that blood draw happened, the hormone could be in a completely different range, right? So I like to really help people understand that hormones are constantly fluctuating. It's a dynamic system, always changing, always moving. So it makes it challenging when we're talking about females and the changes that our hormones take throughout a 28 or a 30-day cycle, where our hormones are and how that may affect our skin. So I primarily see hormones coming into effect in our teenage population, our young adult females who are cycling, and they may have flare-ups of acne on their face, on their chest, on their shoulders, or their back right before their cycle or during their cycle. And it brings in another entire system that I did not mention. So the gut is working to process nutrients and to fuel our bodies. And then we have to think about our body's detoxification system, which is primarily our liver and to a lesser extent, our kidneys and our lymphatics. So our liver, our kidneys, our lymphatics are constantly working to process our hormones. Our ovaries are secreting these hormones, and then the hormones are absorbed into the cell. The cell uses that hormone, and then it says, thank you so much. We're now going to send you back to the liver so the liver can process you and excrete you because we don't need you anymore. Your job is done. So a lot of the time when I have these young women or these young adults who are struggling with acne or rosacea, and they say it's hormonally related, the second half or the luteal phase of my cycle, when hormones are starting to fall, they get these acne flare-ups, and hormones are a big part of it. So things that we think about, again, talking about the foundations or the pillars of our health is, are you active enough? Are you sweating? Are you going out and doing physical activity that's allowing your body to sweat? Because sweating, everybody, is part of your detoxification. Right? And I have so many young women that say, oh my God, I mean, I live in South Florida. It is hot here 10 months, 11 months out of the year. And I have so many young ladies that say, oh my God, it's too hot. I don't want to go outside and sweat. And I'm like, girlfriend, you got to get out there and get your sweat on. You have to eliminate the toxins that you're coming in contact every single day. They have to be eliminated. We have to talk about how much water are you drinking? Are you properly hydrated? That's how your kidneys get rid of their, level of, that's how they detoxify and take out the trash. Our lymphatics are counting on us being properly hydrated. So we talk about food as nutrition. We talk about our excretion or our detoxification pathways. There's a lot that goes in it. A blemish is not just a pimple on your skin. It includes your gut, your lymphatics, your kidneys, your liver, your gallbladder. It's so much more involved.
Yeah, it just goes to show how complex this actually is, and really the need for specialists and practitioners like yourself who have invested in that education, as you said, and are continuing to invest in it, because there are so many complex pieces that go into this. It's not just a topical cream that we can put on there. There are many, many pieces that come together in that. And for other complex skin conditions or even chronic illnesses like lupus or rosacea or some of the ones that you mentioned, what kind of things can you actually do when people come to see you? I imagine there's some kind of testing that you can go through outside of taking a look at the foundations of health, that how people are living and eating and exercising and sleeping. What other things can you help with, or what can you do when they come to see you with more complex and chronic illnesses like that?
Yeah. So the first thing that we really dive deep into is their nutrition, because I'm going to just come out and say that 9 out of every 10 people their diet is what we call the SAD diet. And the SAD diet stands for the Standard American Diet. And it is sad because it is void of those really powerful antioxidants and polyphenols, which are found in nutrient-dense whole foods. Society has gotten away from eating whole foods. So we really need to bring people back to, what are you putting into your body in the form of food as fuel to fuel your body throughout the day. So we really do a deep dive in nutrition. And then, like you mentioned, there is testing that we do. So we do very thorough blood workup where we're looking at nutritional markers like B12 and folate and vitamin A and vitamin D and iron and ferritin and all those nutritional values that are so very important because those vitamins and minerals are running our biochemistry. So if we're deficient or suboptimal in those vitamins and minerals and nutritional elements, then our biochemistry cannot work optimally. So we have to think about fueling our body through food to get the nutrition that we need to run our biochemistry efficiently. So diet is the first thing that we dive into. And then I do a stool analysis. I do a comprehensive diagnostic stool analysis, which is just a stool test. We take a sample and send it into the lab. And that gives us a tremendous amount of information to take a look into our gut microbiome. So it lets me see if we have enough of the good, healthy microbes, the keystone and commensal flora. It allows me to see if there's too many opportunistic microbes that want to take over. It lets me know how well the body is digesting the food that you're eating. How well is your gallbladder and your pancreas working? It shows me the level of inflammation in the gut. It shows me how the immune system is functioning in the gut. So that stool analysis really gives us a tremendous breadth of information to see how the digestive system is working and where it could use support. And in conjunction with that and the blood work, looking at nutritional markers, inflammatory markers, we can really get a good idea of where we need to start. So somebody that comes in with a chronic illness like psoriasis or eczema or lupus, we're going to work on removing the offending things. The body is an amazing machine and it has so much wisdom. And if we just honor the body's wisdom, if we remove what is toxic and we give the body what it needs, it has a miraculous potential to self-heal. So that's really, we do a little bit of testing and then we dive in deep to find out what does your body need that you're not getting? And what are you giving your body, or what is your body getting that it doesn't want and doesn't need that we can take away to relieve some of that burden? And when we can just start doing basic things like that, it's amazing what happens.
Yeah, I was just going to ask you about that. So people are often very concerned that if they get a diagnosis, that is sort of the be all and end all. That's how they have to live, how they have to spend the rest of their lives, or they have to spend the rest of their lives taking pills for something. So how does functional medicine and functional dermatology, how does it sit in sort of that intersection of the medical world and also patients who are looking for answers? Can we expect healing? Can we expect actually changing some of those things that are challenging us? Things like lupus, for example, and psoriasis, I feel like they're very complex, challenging things. What is the prognosis if we are using functional dermatology? Are there cases where that is resolvable? Are there cases where it's manageable and patients get better? What does that look like?
Absolutely. So another conversation that I have with all of my patients, maybe not the first day, maybe not even the second day, but something that we work our way into is managing stress, which we already mentioned and discussed briefly. But what is your outlook and your personal belief on healing? And if somebody is open-minded and willing to really dive in and do the work that's required, because I'm going to be very honest and transparent with you and all your listeners, this is not an easy way to heal psoriasis or lupus or eczema, right? Our society has been indoctrinated to expecting immediate, instant gratification. You go to the doctor, they give you a drug, you take the drug, within hours or days, the symptom is gone and you go on living your life. So what I'm trying to educate people on is this is not, what we're doing is we're rebuilding your your biochemistry, and your cells we're regrowing and optimizing you from a cellular level. So with that understanding, this process, this journey can take 3 to 10 months to complete. It is not an overnight instant gratification thing. So I set the stage for them to understand that it is a process. Your skin cells are only turning over every 30 days. So we cannot expect magic in the first 15 minutes, people. Like, it takes time. So I set the stage for them to understand that. And then I tap into what their belief system is. And if I have somebody that has a very strong belief system and a very, very beautiful mind-body connection where they can lean into and trust their body's ability to heal, that person is going to do so much better than somebody who is married to a diagnosis and identifies their whole entire existence, I have lupus, right? So it's mindset, it's your outlook, it's what are your beliefs, and all of that, all of those things affect your nervous system. And what we really do in integrative and functional dermatology is I'm working on retraining and rebalancing your nervous system, because so many people are living in that sympathetic, dominant fight or flight stage 24 hours a day, 7 days a week, 4 weeks out of the month, 12 months out of the year. They never get into that rest and digest parasympathetic nervous system state. So we're going deep and we're talking about nervous system and retraining your nervous system and rebuilding and rewiring that and leaning into your intuition and your body's own power of healing. It is incredibly powerful.
It sounds like a fantastic way to actually come back to your own healing potential if you're open to it. And if you're not open to it, at the very least, I feel like you're going to get a very good look at what is happening in your body through the testing and where you could start just with your diet, with exercise, with stress management. So at any rate, it feels like functional medicine and functional dermatology has so much to offer and has the ability to offer a healing path that actually is relatively non-invasive and very gentle for people. I mean, you do a little bit of blood work and things like that, but other than that, it is relying on your body and what you do to get better. So I love the idea of that. And I feel like that's very respectful and supportive of our bodies, of our mind, and of our whole being. And I love that you are supporting that and investing so much in getting that education and finding out more for your patients. So this has been really fascinating to dive into. And do you want to share with our listeners a little bit about how they could connect with you, Kerry, and what kind of things they could work with you on, how they can work with you, and I think especially important, where they could work with you?
Yes, absolutely. So our practice is called Whisper Health, and you can find us at www.whisper-health.com. I named my practice Whisper Health because I'm a teeny bit sarcastic and I really want to stand and scream from the rooftops. Like, I have so much to say and I'm so passionate about it. And I really want to spread the word far and wide. So I kind of was a little sarcastic in my naming of my practice, Whisper Health. We want to whisper health to people. So they can find us on the internet at whisperhealth.com. And we are in the US and I am licensed in the states of Florida and Georgia. So in order to work with us one-on-one in Whisper Health's practice, we do need you to be in one of those two states. And, if somebody is not able to get to us in one of those two states, you can reach out and, maybe we could have a quick consultation and I could give you some guidance on maybe how to find a practitioner who's been trained the way I have, that's a little bit more accessible or closer to wherever you are. I would love to be able to facilitate your journey and help wherever I can.
Are there many functional medicine and functional dermatology practitioners in the US, or is this sort of a budding niche that you're in?
It's definitely a budding niche. And I feel like part of my purpose on this planet is to recruit more people and to enlighten more people. Like, listen, this is possible. This is what I do. And these are the outcomes I get. I mean, my tagline is We heal people from the inside out with chronic skin conditions without harsh medication. And it is possible. Again, it is a process. The right person needs to have the right outlook and determination level to do it. But it is possible. And I feel like, part of my purpose on this planet is to spread that word and to get more people out there practicing in this capacity.
Yeah, absolutely. I 100% agree with you. And not just in the US, but other countries as well, wherever people need access to this so that we can have this as a complement to, as you said, our traditional medicine, which can be so helpful and crucial in many different situations, but as a complement, also actually looking at root causes and helping our bodies heal from our innate abilities to heal ourselves. So that sounds like a wonderful combination of things. And Kerry, if our listeners are curious now, and some of them might have all sorts of things going on with their skin or with their gut or anything in their body that they haven't gotten an answer to, they haven't gotten help for. So they may be curious or maybe even confused or overwhelmed by what we just talked about. What is a good step for them to start with if they're wanting to dip a little bit into functional medicine, maybe find out more about it? Where do you usually start with your patients or with your clients when this overwhelm, or like you said, this analysis paralysis has set in? They realize they need help. Where do they start? What's a good first step?
I will say that we lead our patients to start with their food. I think that's something that's easiest within their own control. You're making choices about your nutrition 3 to 4 times a day. You're typically having 3 meals a day, maybe with 1 or 2 snacks. So starting with food is an easier place to start. And just really thinking about, what choices am I making to fuel my body? So we want to just lean towards whole foods. If it comes in a plastic container or a bag or a jar, is that a whole food? And if it's not, maybe you want to make another choice. So that's where we start with our people. And I will say that the Institute for Functional Medicine, the ifm.org, is a really amazing educational body that is on a mission to train medical professionals how to practice integrative and functional medicine. So if somebody is looking for a practitioner near them, I would definitely refer them to the IFM, because it's a great organization, even for the layperson, to get information on what functional medicine is, how we're trained, what we're trying to do. And that'll be a great resource for people.
Fantastic. Thank you so much for that. And we, of course, will be linking to all of Kerry's offerings in our show notes as well. So if you live in Florida or Georgia, you can connect with Kerry directly. You can work with her. And if you're outside of those states or you're somewhere international, you can maybe still contact Kerry or her practice to find out if there's anyone near you that is practicing functional medicine that you could connect with. And again, we'll be adding the resource that you just mentioned as well for our listeners to check out, to make sure that we get as many people as we can who are interested in this and who need help and support to you and to other practitioners to shine your light for integrative medicine. I think that is absolutely wonderful. And thank you for coming here today and sharing all this knowledge and wisdom with our listeners and opening the door to have a little bit of an insight into what functional dermatology is and what that means for people, especially with chronic illnesses, chronic conditions, like you mentioned. Thank you so very much for being here today and chatting with me, Kerry.
Well, I thank you so much for this opportunity. It's been a wonderful conversation. And I have so much gratitude for people like you who are hosting podcasts and allowing people like us to come on and spread our message. So thank you for doing what you do.
Oh, thank you so much. And just a little part of, as you said, getting that out into the world and providing some space for amazing practitioners to come and talk about what they do. I feel like people often know they need help, but there is this disconnect of, where do I get the help and what kind of help do I even need that will do what I needed to do? So this is such a crucial piece of linking up the many amazing services that are out there with getting them to the people who need them. So thank you for being part of that. Thank you for the amazing work that you do, Kerry, and take really good care of yourself.
Thanks. You do the same.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.